So, um, COVID prevention is, of course, for ourselves from patients. We have already discussed. We have to take COVID appropriate behavior. A lot of literature and information is coming on COVID appropriate behavior. And among these, social distancing, mask, hand sanitization. Even now that the talk of and availability of vaccine is um, being is available now, but still the most effective way of prevention is COVID appropriate behavior, which is social distancing, use of mask and hand sanitizer for ourselves and for anybody. We are more exposed occupationally, so we have to be very, very careful by ourselves. These are the common drugs, and various institutions, various states, various group of practitioners have used them differently. Some people will use various institutions, various physician groups, various states, and protocol makers have used these drugs differently. Some will use azithromycin. I am practically using most of the time. I'm using doxycycline as antibiotic because it has also some antibiotic properties, and this is what is being also being used from by our colleagues in All India Institute of Medical Sciences. Paracetamol is not only useful for fever, but it has also anti-inflammatory properties. As we know, paracetamol has anti-inflammatory properties, it has antipyretic properties, and it has analgesic properties. So even when patients do not have fever, I prefer to give to my patients half paracetamol for anti-inflammatory property for a longer duration, for 2 weeks, 3 weeks times for anti-inflammatory effects. And many people, even when the fever is cured, they will have some kind of inflammatory surge. They will feel abnormal. They will feel tachycardia. They'll complain of temporary feverish feeling, and in those cases, this is important. Even hydroxychloroquine, not only for prophylactic purpose, but for even from treatment point of view, it has anti-inflammatory properties. So this is helpful in settling the inflammation, even if you advise during the duration of the illness. Steroids, I've been using Visolone, prednisolone in my own practice, and many times if patients will. Hello, is it okay now? Okay. Sorry for this repeated interruptions because of the unstable internet I have at my end. Somebody asked about whether steroid is indicated in GP practice for a suspected COVID patient with symptoms not getting better within conservative management 5-6 days. Yes, if patients have severe cough, or if they have ongoing fever even after 5-6 days, uh, even in the beginning, I would prefer to give some steroids, very low dose. Some patients with cough, if they are COVID positive, I've started even with 5 mg Visolone, and later when if there is an issue of saturation, fall in saturation, I have raised Visolone dose up to 20 mg thrice, depending upon the situation of the patient and complaints, and normally these patients would improve on graded steroid introduction, or and then gradually we have to wean off. Once you give steroid, when patients start improving on their saturation, it is important that you wean off steroid very, very gradually, because if you have given steroid for 10 days, 15 days, many times if you stop suddenly or reduce the dose suddenly, then they may have withdrawal symptoms. They may feel extreme weakness, exhaustion, lightheadedness, giddiness, and all kind of steroid withdrawal symptoms may happen. So it is also always important uh, to withdraw steroid in a very graded manner. Vitamin C, vitamin D, these all have been recommended. B complex, zinc for immunity, and they are also important for our uh, our uh, even if you look at the soft tissue, uh, uh, their capacity to repair itself. It is important that these we are not deficient. Our patients are not deficient of any of these micronutrients and vitamins. So it's very, very useful to give these vitamins in my understanding. All of this, in appropriate doses, vitamin C, D, B complex, zinc. Fabiflu we have already discussed. I am not giving it my own practice, but many doctors are giving it. They say that it has good outcomes, but I see that even without Fabiflu in outpatient basis, most mild cases would improve by themselves. There's no requirement in my experience and understanding of antiviral in family practice. Remdesivir, of course, is better be given at a hospital for moderate to mild, severe kind of patients. So, anxiolytic, somebody has asked Dr. Nina, dose of anxiolytic. So, anything, even simple alprazolam would help you 0.25 or zero point 0.5. I would uh, low doses, anything. It depends on the patient's condition. So, prefer not to give any, sedatives because patients may have, compromised lung function or, compromise cardiovascular function, and they they may be harmed. So anxiolytic of normal routine dose, lowest possible dose you can start, and you can see most of the patients with counseling as well as with some low dose anxiolytic basic. I can say simple alprazolam 0.25 mg would help 0.5 mg many times. So these are all important aspects of home management. And then how do we manage connection with your patients? Now it is easier because of the Medical Council of India telemedicine guidelines. Uh, it is a legal thing to give a digital prescription. So in the beginning of my practice, I used to write a prescription on my letterhead, and then I would scan it with cam scanner or Adobe scanner, and I would simply share on WhatsApp to my patients. And WhatsApp has been easier because WhatsApp has the same mobile number. You can call the patient the same number, and also many times, if you are a private practitioner, you can get your fee paid on Paytm or other channels. Because during lockdown, I saw around 1,000 patients through this method only. I would take their consent and have their basic demographic record through Google form. And whenever somebody contacted me for consultation, I'll give them a Google link where I'll have their basic demographic information recorded. And then, if required, I would do a video consultation on Google video call or simple telephonic call. Then I will uh, write down my prescription on my routine pad with my own hands, and I will scan it and send it by WhatsApp. And it is very easy to scan by Adobe, and most of your scans will remain in record because you have to create an account which is linked to your Google Mail, and most of the data is can be stored by even a single using your Google Drive or Google Form. You can record all your database. So all patients I saw during lockdown when I was not seeing patient directly, I have their records filled through my Google form, and I have available with me. I know which patients I have treated, which areas, which age group, and what treatment I have given because I have kept scanned prescriptions of all my patients. So uh, practically, because there are many apps, softwares in market. Doctors are doing practice through Practo, DocSup, and all. But if you want to have your own personal, my advice be to using WhatsApp, some scanning software like Adobe. It's a very good quality. Then using same phone number, some phone number which you designate only for consultation, not your personal phone number, which you can switch on, switch off whenever you require. Same number you can link to your Paytm, Phone Pay, or Google Pay, so that you receive your payments also. And Google Suite, which is now called Google Workplace, which is a upgraded version of the Google account that we normally use. Even with your normal Google account, if you have a Gmail account, if you look for it, you will have a drive. You can create Google Form, Google Sheets, and Google Documents where you can keep all your patients' records. So I've been using Google Suite because it's upgraded version. I get better data space, and of course, if you want to use other platforms like Practo, DocSap, I'm fine and all. You can always use them, but then uh, because these all apps are also marketplace, you enter into marketplace. Or as family practitioners on long term, uh, you know, our patients are our wealth. So if a family 3,000, 4,000, 5,000 families following you, you'll not be dependent on anything else. So protecting your data, your patient community is very, very important. So it's better to use your personal database for having a telemedicine. That is my advice. Going to a bigger telemedicine platform, you will get some patients, but there is also risk of losing your patients because they are also like marketplace. So now this vaccine is coming, and it is supposed today, yesterday, day before yesterday, mock drills of vaccine administration across states. So today only I was reading in newspaper that health minister announced that there was a mock drill in all 730 plus districts in India, and government would be providing these vaccines almost free. There will be priority to healthcare workers. Let us hope that this vaccine works well, and the turmoil that the whole world, our country, we ourselves, people have been going through will come to this end. This is the Bharat Biotech uh, vaccine vial, Covaxin. So let's hope. And of course, this is being given administrator through the government system at the moment. But in future, of course, it will become available in market. We should be knowing how much it costs in future, which companies doses are available, because strains would change over a period of months, years. You know, coming 2 3 years will be very very important from this pandemic point of view. So we should be knowing about what is all happening in the field of vaccines also. And in future, when it becomes available in market, then we have to advise them as per requirement, because this vaccine has to be given across all age groups. So family physicians role, it is very important that we understand role of in vaccination, not only for COVID vaccine, but for we should learn about influenza vaccine, pneumococcal vaccine, and whenever there is a requirement indication, we should be knowledgeable about. So there's a question by Dr. Maimuna Ahmed. Will the management be same for the new mutated strains? Uh, I, in my experience, as I said, we have to look at the impact of the COVID strain. Largely, uh, it is inflammatory in nature. So, what kind of inflammation the new strains cause? How much devastating they are? So, if you look back, during the months of April, May, we were hearing all very bad stories from looking at the lungs of CT scans of patients which were coming from Europe and America, and that was so we should not be worried about the new strains, mutated strains. Largely, we have to manage its anti-inflammatory impact, immediate, intermediate, and long term. So whatever strain may come in future, I doubt they would be more severe. And this is the trend of any pandemic or any virus. Gradually, the newer strains would be lesser virulent over a period of months and years. This is what happens historically. New strains will come, but they will be less powerful, less harmful in future. It is not that the newer strains means they are more dangerous, more severe. So I hope that answer your questions. If you look the pandemics, viral pandemics, the strains would become weakened over a period of time, not the other way. But there are concerns about the new strains in UK and all. Vaccines. Somebody asked, does Covaxin help for new mutated strains? As you know, for influenza vaccines and all, uh, every year, because these strains are being studied, and for every year a new vaccine comes, a new preparation comes, which is supposed to be more effective for that particular circulating strain. So this will also be happening same with uh, coronavirus, COVID, and in future there will be more mutations, new strains, and every year some new modification of the vaccines would be coming. So as for now, for this year, this is still going on trial basis. This was an emergency approval, so we have to trust the present vaccine which is being administered now. And future, you know as the data comes, what kind of strains, what impact, what kind of immunity it is generating, newer versions of vaccine will also come. So if you know, every year the normal influenza vaccine changes. It is not the same strain that we administer every year. So this is all. So thank you all for your valuable time. I hope I tried to be practical because there's a lot of theoretical information available. A lot of it is what we call as infodemic, excess of information. But we have to be mindful what information we use for in our own practice for ourselves